In matters of health, Zimbabwe has achieved many successes by overcoming stigma, shifting cultural norms, and benefiting from strong political will and investments by the government. Despite these efforts, too many Zimbabwean women are still dying, partly because we are not doing enough to address one of the leading causes of maternal deaths, unsafe abortion. In Zimbabwe, 4 out of 10 pregnancies are unintended or unplanned, and 25% of those unintended pregnancies end in abortion. Even though the topic of abortion may seem taboo in Zimbabwe, it is a conversation we need to have because this silence is devastating our women and girls. The truth is that unsafe abortions are happening in our country every day. In 2016, more than 65,000 induced abortions occurred in Zimbabwe. Most of these abortions were clandestine and potentially unsafe, performed outside the formal health system. Many women and girls are driven into the shadows because of our country's restrictive abortion laws and a lack of clarity about their provisions. The 1977 Termination of Pregnancy Act, or TOP, is the main legal document in Zimbabwe that guides access to abortion. The TOP, as it is currently written, creates many challenges by requiring a long chain of complex steps that can feel virtually impossible to navigate. Not everyone is aware of this law and what it allows. This lack of awareness leads to confusion and fear, which can prevent women and girls from seeking an abortion and prevent providers and others from helping them to access the service. In a 2016 survey, only 25% of healthcare providers knew all the conditions for which abortion is legal in Zimbabwe. Restrictive abortion laws, like the 1977 TOP, do not actually reduce the number of abortions that occur, and permissive laws do not necessarily lead to more abortions. What does change, however, is the safety of abortions. In Africa, where most countries have restrictive laws, only 1 in 4 abortions on average are safe. When abortions are unsafe, they are more likely to lead to complications that would be extremely rare if they had been carried out according to WHO guidelines. Women and girls with abortion complications need post-abortion care or PAC, a service that is supported by the Ministry of Health and Childcare. According to a 2016 study, 2 in 5 women in Zimbabwe who sought PAC had moderate to severe complications, such as infections and injuries to the uterus that required treatment. Only half of the women who had abortion complications in 2016 got the care they needed. There are many reasons why women do not get the right care, including a limited number of facilities that offer PAC services, stockouts of critical drugs, lack of appropriate medical equipment, and costs of transport and supplies. PAC is costly to provide, but much of this care wouldn't be necessary if abortions were carried out safely in the first place. One well-regarded analysis estimated that the annual cost of providing PAC in all developing countries is around $232 million. But if all abortions were provided safely, this cost would drop more than tenfold to about $20 million. Regardless of our own beliefs or the choices we might make personally, we can still empathize with women and girls who find themselves in need of safe abortion. We have the power to prevent unnecessary deaths and disabilities. We can start by breaking the silence and talking about the critical issues. We should acknowledge that the 1977 TOP is not suited to the current realities in Zimbabwe. Let's talk about how this act has many shortcomings. The TOP should be reformed to be in line with WHO guidelines. When these reforms are made, we need to ensure everyone is clear about what is legal so they can make well-informed choices. We should close the knowledge gaps that exist when it comes to sex and family planning. Let's talk about how to ensure that women and couples have accurate information and contraceptive options so they can prevent the unintended pregnancies that commonly lead to abortion. And finally, we should remedy the poor state of our health facilities. Let's talk about how to ensure that we have enough facilities with adequate supplies and equipment to provide safe abortion and PAC services. We must meet the challenge of addressing these important issues. It is time to break the silence, to raise our voices, and to make the changes needed to protect women's lives and ensure the world sees Zimbabwe as a leader when it comes to health and policy. Now is the time for action.